I'm going to be showing you how to put on and wear your hip brace. So when we get the brace, it has this lovely little hinge. It gets locked out at 60 degrees flexion, which means you won't be able to bend your leg past that point. And once we adjust this, you don't have to bother with it at all from that point on. So with fitting this brace, we will adjust the brace so that it conforms to each person. When you're putting this brace on, it's very important to have it in the proper position. If it goes too low, too high, it will allow you to bend past the 60 degrees. So very important to check it periodically throughout the day while you're wearing it to make sure that it is in the proper position. So this brace is made for the right side. When you're putting this brace on, you want to make sure that it is lined up. Turn a little bit this way. Lined up so that it is right down the side of your body. This hinge right here needs to be at your actual hip joint. Easiest way to find that is you find the very top of the pelvic bone. Some people don't really know where that's at. They might think it's a little bit lower than what it is. Dig right in there, feel the top of your pelvic bone, put your hand on it, drop your fingers down. That's where your hip joint is. So we are going to line that up. Go ahead and move your hand. Then I'm going to have you hold on to the brace right there for me. Lift up your arm there. So this brace can be adjusted to fit each person. These are also bendable. And this again is where you're going to need help having someone get the brace on, because you cannot bend to reach these. With these straps, you want it to be snug enough that it doesn't fall down off of you, but it doesn't have to be pulled so tight that you're going to be cutting off your breathing ability. So now that you have the brace on, it's in the right position, this is what you'll be wearing throughout the day as soon as you get up. There are a few things that you have to take into consideration wearing the brace, and that's sitting and getting back up. So I'm going to bring the chair over here, and I'm going to demonstrate and then have you do it, okay? So when getting in and out of a chair with the brace on, you're going to need to kind of kick that bad leg out there, the bad hip side. Hold on, be careful of your thumbs. That little hinge is very hard metal, and it does hurt if you catch your thumb on there. So you want to make sure your thumbs are out, foot is out a little bit. You're going to kind of lower yourself into the chair. Most people want to go bottom first, and that's kind of is trying to force you into that bend that goes past 60 degrees. So again, just careful of your thumbs, kick that foot out, lower yourself down. It's going to be the same thing with getting up. You're going to kind of keep that out. Try and use your arm strength and get up out of the chair. So I'm going to try that. Yep, kick it out and kind of just, yep, and then you can scoot back. The brace will stop you. So if you try to sit up straight or bring your leg up, it is going to stop you at that 60 degrees so that you can't bend. And again, always keeping in mind, making sure that the brace isn't slipping or going up too high. With the brace, it's going to stop you at 60 degrees. So if you bend your leg up, it's going to stop you right there. Okay, so that you can't go past 90. It will keep you from also externally rotating your hip, which would be out this way, which we do not want you to do. It won't stop you from externally rotating your foot, which we also don't want you to do. So doing that, show them with your foot out, that is externally rotating. That actually affects your hip. So you want to be mindful of keeping your foot, again, straight in front of you.